nervous because I'm not, you know, a certain skin.
Okay, let's talk a little bit about dermatology. So, you have doctors or dermatologists that strictly practice medical dermatology. So, they work with insurance and they don't do anything outside of that. And then you have dermatologists who also do cosmetic dermatology. So, they might be the ones who do botox, fillers, and then if they have additional training, then they might also do laser related dermatology. It's important to understand that depending on where a dermatologist gets their education, they may or may not have a lot of education or experience with treating people of color. And so let's say you finish your dermatology residency and you want to open your practice. The equipment that you're going to get in your practice is going to be determined by where you're going to be and the demographics of the location that you're going to be in. At least that's how I understand it from a business standpoint. You also have to remember that if you have limited experience or education on treating people of color, then you're probably not going to feel very comfortable treating people of color in your practice. And so you might in turn only see them for medical dermatology, but if there's something cosmetic, you might then send them away. Personally, I think in this lady's situation, she should have been told that they did not have equipment that was safe to use on her skin tone. Instead of having her come in for a visit for chin hair removal and then having to pay a copay without getting the treatment done. So I really understand why she's upset. So if you're interested in any sort of cosmetic treatments and you want to see a dermatologist, you need to do research to find out if that dermatologist has equipment that is safe for darker skin tones. Hopefully, this should be available on their website, and you could also tell from like their social media sometimes. And if you're not confident, then you might need to find a doctor that specializes in treating people of color. Now, there are non-core physicians out there who practice medical aesthetics. Personally, I'm an internal medicine physician who likes aesthetics, and I recognize that there's just not enough dermatologists of color in the country at all. And so you can see how it's difficult for people to actually find dermatologists that focus on skin of color. So, because it's something that's of interest to me, I decided to take the time to learn a lot about it. So, I've read a lot of books. I go to conferences, I've learned so much about laser dermatology, and I'm able to help my patients with their skincare needs. And I continue to learn, and if I learn new things, I bring them to the practice. But not everybody's focus is going to be treating people of color. Now, ideally, every dermatology practice should feel comfortable treating people of color, but that's an ideal situation. So, in the meantime, look for aesthetic practices or dermatology practices that focus on treating people of color so you're taken care of the right way.